With luggage consisting of beddings and a pillowcase, Denis Twahikahas set shop at the Constitutional Square. He also had water to take him through the day, as well as some books, including a copy of the Constitution, to while away the hours. He has decided to go on a hunger strike for 25 days. He is a man with an issue.
I want these drugs from government stores to go to the citizen down there and cure those illnesses that are killing our people. Is it intellectual savagery that is responsible for all this? Drugs are there full to capacity, but people are dying because of shortage of drugs. The reason as why they are not requisitioned, it's because drugs are marked the government of Uganda not for sale. So those who use it to steal drugs find it hard for these drugs to be sold.
According to Denis, this has gotten out of hand, something the Ministry of Health and National Medical Stores have acknowledged.
We have also had it, like you've had it, that some people are not interested anymore to order for these drugs because of that reason.
He's mentioning a scenario which is interesting, that our people may refuse to prescribe medicines because our medicines can't be stolen because they are marked government of Uganda, and they cause a pseudo absence to force patients to go and procure those medicines in private clinic.
Denis's hunger strike against drug shortage in most government health facilities has drawn many people here, and most of them, the issue that comes out clearly is the fact that private clinics should be done away with.
I'm supporting him because when you go to a government hospital, they give you a reference to private clinic. Now, a private clinic and the government, which one is responsible for the humanity?
I think we can streamline their operations instead. The private clinics are an important component of our care in terms of service delivery because they constitute the private sector. And the genuine private clinics can't do that. The clinics manned by quack people, whom we are zeroing on, are the ones which would be doing this.
These are your papers.
Meanwhile, Denis was taken to CPS to give a statement, though he had written a letter to the Inspector General of Police for security and protection. A visit to National Medical Stores in Entebbe revealed rows of drugs, with some being shelved in corridors.
National Medical Stores only sends medicines to the facilities when we have an order for them. If you don't give us an order, we continue patiently waiting for you to send us your order. It is a challenge to us now that we do not have adequate space, but as we push out, as we get the orders and pack the medicines and deliver them, we'll be able to create space probably in the next 1 month.
The Ministry of Health has encouraged the disgruntled patients to send their concerns via an e-mechanism called M-Track.
You will message on 8,200, and within 24 hours our team will be there. We would advise that he should not hurt his body. His cry is the cry for Ugandans. We thank him and congratulate him for taking that bold decision.
Late this afternoon, Denis was released, and he has told us on the phone that tomorrow he will be continuing with the hunger strike until the government realizes that there is a problem. But now, after the interaction with the Ministry of Health and the drug suppliers, NMS, it is clear that all have acknowledged that there is an irrational situation, something which may see this father of two soon enjoy his wife's homemade meals again. Florence Nalimba, NTV.